we have an obesity problem in this country. And so much of our money is going towards people who have unhealthy lifestyles that all of us are subsidizing that. About 25% of your money is going to diabetes, type 2, primarily diabetes. United Healthcare has 15 times more diabetes members per capita than any other health plan out there. So how does that happen? And I might be one of the few people out there saying, we need more uninsured people as opposed to less uninsured people because it brings back more market forces to the hospital systems or the healthcare system. The studies that I've seen is about 80% of chronic conditions are lifestyle related. So those are things that you can change, especially if you're in your 30s or 40s or 50s, so that when you're in your 70s, 80s, and 90s, you don't have these chronic conditions.
Today we have with us Andy Schoonover. He's CEO of, I believe CEO is your title, at CrowdHealth. It is I guess you call it an insurance alternative. He's been very, very particularly beneficial to the carnivore community for one, I think, with regard to that, and very receptive to our sort of way of taking care of our health. So Andy, I know we've talked before, and I got to meet you in person for the first time over that little Bitcoin conference. You can verify you can eat a lot of steak, and a lot of people
have you eaten since then is the question.
No, I've eaten plenty. In fact, I got a big old 4.5 pound pecan. I'm going to eat. Me and my son are going to split here in a little bit. But
I saw it firsthand. I can attest to the fact that you put down 3 tomahawks. It was an impressive feat.
Yeah, it was. I didn't have my knife either, man. I had to use I had to use a little plastic fork and a paper plate. And I'm just out of my little. If I had a big old sword on me, I'd crush it even faster. But that's all right. Anyway, Andy, let's talk about healthcare. Let's talk about what you guys offer, what you guys do, because I know a lot of people are interested in healthcare. Costs have gotten ridiculously expensive. Just the premiums people pay, plus the co-pays, plus the ridiculous amount of money that the drugs are costing. That's alone a reason to say, hey, I don't want to go to the doctor anymore. It's damn expensive. Obviously, we have to take care of our health, but to me, that's a good reason to try not to be sick, try to take care of your health. But tell me a little bit about the origin of what you're doing, why you decided to do that, and then we'll get into maybe more of the mechanics and more of the details.
Yeah, I mean, I felt that firsthand. This is my second healthcare company, so had the first one, sold that one, and as such didn't have health insurance. So most of us get health insurance from our employer, but since I didn't have an employer anymore, I didn't have health insurance. And as you probably know, COBRA is even worse than regular health insurance. So I went on to healthcare.gov and got a plan for me, my wife, and my 2 girls. It was $1,200 a month, and it just didn't work. In essence, I had one issue with my little one, who was 1 at the time, who had a perforated eardrum, and the plan wouldn't pay for treatment. And so I quit that and said, screw this, I'm out of here. So I've been uninsured since I think around 2000, maybe a little bit earlier than that. And to try to figure out how can I navigate the system without having health insurance, and started putting these tools together. And the culmination of that was a company, because my wife and I looked at each other and said, I bet other people would want to do this too. This works so well. So we started CrowdHealth in April of 2001. So we're a little over 3 years in, and it's just been incredible to see the fact that we saved our members about $10 million thus far over the last 3 years in healthcare costs, just by, in essence, getting rid of the health insurance middleman, which is the cause of so much of this disaster in our system.
What is the middleman doing? Why do we have a middleman if you can do this without that?
Yeah, in essence, what they're supposed to be doing is they're supposed to be using their size to negotiate really good prices for us. But in fact, what has happened is they've put in so much bureaucracy, plus add perverse incentives. And actually what they're doing is they're actually looking for higher prices instead of lower prices. See, the health insurance plan actually makes more money if prices go up. And so there's a principal agent problem here. They're supposed to be our agent. They're supposed to be looking for low prices for us. But in essence, what is happening is they're incentivized to see prices go up over time. So this is so counterintuitive to people. They don't understand it. But here's the quick math on this. Health insurance plans can only make 15% profit on your premiums. So to make the math easy, if you have $1,000 of premiums, they can only make $150. So how do they increase their profit by 10%? Your premiums have to go from $1,000 to $1,100. So now they're making, instead of $150, they're making $165. So the entire payer of the system is incentivized to see the prices go up. the seller of the system or the services in the system, the hospital systems, they clearly want the price to go up. So you have the buyer and the seller both wanting the prices to go up, which is just leads to, of course, the inevitable, which is prices go up. But you add that, Shawn, with just the fact that we have an obesity problem in this country, and so much of our money is going towards people who have unhealthy lifestyles that all of us are subsidizing that. So about 25% of your money is going to diabetes, type 2, primarily diabetes. And it's with what you're doing over at Revero, like that doesn't need to be happening. It is solely, exclusively a result of one, not exercising, and two, what we're putting in our body. And that's why we love the carnivore community, because what we're seeing is that the carnivore community are not having these expenses. They're not having these costs. And so that's why we're excited to get a group of these folks together to fund each other's healthcare expenses.
Let me ask you back to the fact that you've got insurance companies that would prefer that the premiums and the prices be more expensive. Obviously, the providers, the hospital systems, the drug manufacturers want the prices to be very high. Why is there like some smaller health where insurance companies say, hey, we'll be more discount, we'll save you a little more money and attract more customers? Why? Correct me if I'm wrong, but there is becoming a monopolization of the healthcare market. I think United Healthcare, Aetna, Blue Cross Blue Shield, most of the big boys have squeezed everybody out. Is that right? Now we're down to just four or five players. Is that the landscape?
Exactly. They call them the BUCAs. So it's Blue Cross, United, Cigna, Aetna. Those four, if you added Humana at the end, those five comprise the vast majority of our healthcare. So think about going into a brand new state. I live in Texas, and you would live in Washington, both pretty significant sizes of states. If you want to be a new health insurance provider in that state, you have to go and contract with thousands of doctors, hundreds of hospitals. And so it makes it nearly impossible. And oftentimes these BUCA plans limit their ability, these hospital systems' ability to contract with other providers, other health insurance providers. And so there's a monopolistic play going on here, or at least an oligopolistic play going on here that's keeping some just competition within those markets. The other thing too is if you're in Texas and you're an insurance company in Texas, then it's very difficult for you to go be an insurance company in Oklahoma or Colorado or Louisiana or any of those others. And so there's almost a monopoly within that state as well that only allows a certain number of health insurance providers within that state. So there's all kinds of non-free market activity going on here that is primarily driven by regulatory actions that are supposed to protect us as the consumer. But in fact, actually what they're doing is hurting us as a consumer because we're paying these ridiculous premiums for health insurance.
Is there any level of collusion? Do they fix prices with each other? They say, hey, we're going to agree on, which I think should be illegal if I'm not understanding. I don't know. Do you suspect there's like the CEO of United talking to CEO of Aetna and said, hey, man, you can't drop your price too low because it's F everything up for everybody else. Is that going on, you think?
Yeah. Let me just say first, before I answer that, United and Cigna have lots of money. And they will go after anybody who says bad things about them, especially they're inflammatory. And so let's just say I do know this, that the insurance plans are working against mostly the local systems to crush the little guys and contract primarily with the big guys so that they can see prices go up over the long term. So what's happening here is specifically hospital systems. For example, I have two hospital systems in Austin, Texas. It's St. David's and Ascension. What St. David's and Ascension are doing is they're buying up all these little doctors' offices. 10 years ago, 80% of doctors were independent. Now it's only 20%. So it's totally inversed over the last 10 years. So these little doctors' offices who are getting really crappy rates from the insurance plans, they're buying them, bringing them into the system, the hospital system, and as such, then are raising rates. And so these health insurance plans are promoting that, actually, because what they're doing is United Healthcare comes into a little doctor's office and it's 50%. Let's just say I'm getting 50% of my budget from United comes in and says, hey, I'm going to drop your price by 30%. And what are you going to do? Like you can't do anything. Or United says, you know what, or else I'll buy you. United Healthcare is the largest owner of doctors in the country. They own, I think it's 100,000 doctors. So there's enough. I can't say it's directly collusion. There is definitely anti-free market activity going on due to the duopolistic, oligopolistic forces going on in certain cities, and most big cities have these same kind of market impacts.
So let's talk about your model, because you're not a health insurance company technically, because there's some things you do now that you would not be allowed to do as a healthcare entity. Primarily have a sort of a pre-selected group of healthy patients. That is, I think the Affordable Care Act and all that stuff prevented you from doing that, prevented you from excluding. Like most of these United Healthcare companies, they take on the sickest of the sick, and they probably don't want to. They're forced to by law. And then that drives up, maybe they want to now because it can drive over everybody else's costs, and maybe they just build extra in for that. But talk about your model and how that's different. How do you get into, because as you mentioned, it's hard to negotiate a contract with 100,000 doctors in all different places. So how does that work for you? How do you get in there?
Yeah, let me start with you at the first part of your question. A study just came out. I might get the numbers a little bit wrong, but United Healthcare has 15 times more diabetes members per capita than any other health plan out there. So how does that happen? In essence, what United Healthcare is doing is they're going around and they're saying, oh, I get paid more from the government for diabetes patients. And so I'm going to try to do anything I can to code these people as diabetics, because now I get $1,000, $2,000, sometimes $3,000 more per year for those diabetics than if they were like me and you who aren't diabetic. And so they're gaming the system that way. And the second part of your problem, how do we do it? Look, it's how you'd go out and buy anything else. You'd search around and you say, I want to find a great, in your case, right, orthopedic surgeon in Seattle, Washington. And I then go negotiate with that orthopedic surgeon for a really good price. If you don't want to do that, CrowdHealth will do that for you free of charge. It's a part of our service. So let's just say you go and tear your ACL and you're looking for an orthopedic surgeon. You call CrowdHealth. We'll go around and look at all the great orthopedic surgeons in Seattle, Washington, or Austin, Texas, or wherever you're at. We will call them. We'll say, hey, what does it cost to do CPT code X, Y, and Z, basically to fix your ACL? And they'll give us a price. And we'll say, hey, what if the member pays at the point of care? Will you give them a discount? And most of the time, there's a significant discount that is applied to that. So in essence, what we're doing is we're ripping out that bureaucracy of the health insurance middleman, because typically what that orthopedic surgeon would have to do is call the health insurance plan, get it pre-authorized, then fight to get paid afterwards. And so if somebody shows up and says, here's a credit card with $15,000 on it, I'll pay you right now, the orthopedic surgeon generally will take a lot less. We had one just 9 months ago, probably in Austin, playing pickleball. It was a $22,000 or $24,000 was the quoted price. We got them to move it out of the hospital into a surgery center. The orthopedic surgeon, the anesthesiologist all took discounts because we're paying at the point of care. I think the final price of that was like $11,500 or something like that. So it was 50% discount by getting it out of the hospital and paying at the point of care, which removes all that bureaucracy middleman. And we had, I think 3 weeks ago, we had something like 60 doctors reach out to us and saying, hey, will you send more people our way? Because we're so tired of dealing with the bullshit of health insurance plans that we really would like to get more cash pay patients. And we will, take significantly less if you could pay us at the point of care and not have to deal with all this bureaucratic BS that you have to deal with as a doctor. And that's what drives our business, is just the bureaucracy, the incompetence of big health insurance plans.
Let me ask you because you just mentioned 80% of physicians nowadays are employed. They're basically working for corporate medicine. Are you primarily going to the independent providers, or can the guys that are still working with the corporate crowd even accept your stuff? Are they just so stuck in the system they can't even accept your stuff?
Yeah, they can. It's much, much harder. But we try to go to the independent guys. I think one of our kind of submissions is to support the independent doctors so they can survive without having to be a part of the corporate bureaucracy of the hospital systems. And it's becoming harder and harder for those guys every day to buck the trend of big private equity mass merger type stuff. We're trying to go to the independent. I would say probably 70 to 80% of the time we can get people to an independent. It really depends upon your location, city, things like that. But we're trying to support the independent docs. They don't have to deal with this insurance stuff anymore.
So obviously every state has different rules. As you mentioned, Washington didn't like you initially, and I guess you actually had to sue Washington or fight in court for being able to practice in there. Are you guys now in all 50 states, or where are you guys practicing?
Yeah, all 50 states and Puerto Rico, DC, I think U.S. Virgin Islands too. So we're all 50 states, and in fact, we've actually got some people who are international as well. So if you are, domiciled in the United States and can get a United States bank account but live in a foreign country, you can also use CrowdHealth. So we are international now, I guess you could say. So lots of expats who are domiciled in the United States but live abroad use CrowdHealth as well. And it's one of the cool things about us is you just said you're headed to Europe here soon. If you're in Europe and you get hurt, you have an urgent care visit or an emergency care visit, you can use it wherever. So it does not matter where you are, you can use CrowdHealth. Just out of curiosity, have you noticed, were some states a lot easier to set up in than others? Was there like some states are real receptive to this and other ones are not so easy? Yeah, and I think it's more just the prices vary significantly state by state, which is crazy. If you want to go buy a Ford Explorer or whatever in Dallas, Texas versus Seattle, Washington versus Denver, Colorado, your prices are not going to be substantially different. That is not the case with healthcare. They can be substantially different between those places. If you go to the western slope of Colorado, which I was just there last week, prices are probably 2x what they are in Austin, Texas, which just shows the kind of inefficiencies of our systems. It's harder to set up in places like Colorado and Wisconsin and California, places where the prices for healthcare services are significantly higher due to monopolization of the system. They also, some of these states have what they call certificate of need laws. They're called CON laws, which actually forbid hospitals or any kind of entrepreneur to open up a new facility in that state. So what happens is these conglomerates go and buy up all the facilities in the state. You can't open up new ones, and therefore they limit the ability to compete with them, and then they can drive prices up. And so a lot of the states that I just mentioned have these con laws, and it's impossible to compete. And it's a government forced anti-competitive law, which is unfortunate. But some of these states are very expensive to provide healthcare in. And so that's what makes those difficult. But we're set up everywhere, and I'm happy to have anybody join us wherever you live.
Let me just delve into who can join you and who can't, because you have inclusion-exclusion criteria. And so who would be a good fit for you guys? Obviously, you're taking on lower risk patients that don't have a plethora of medical issues. And who would not be appropriate for what? Is there age ranges? Tell me some of the details on that.
Yeah, only age issues that we have now is Medicare. So if you've hit Medicare, we can't unfortunately provide you with service. Again, there's laws that say that doctors cannot accept cash for a Medicare service if you are Medicare eligible, which is just...
So that's age, 65?
65. Yeah, 65.
So no one over 65 is eligible, right? They're just
no
can't
one under
do
65,
right.
No smokers. And if you're over 260, then you're ineligible unless you have we make exceptions for folks like you who are over 260.
I was 250 this morning, by the way.
Okay, all right. You're in.
So.
You're back in. You're back in. And then non-smokers, if you're a smoker, then you're not eligible. I think that we've actually our criteria has expanded here with our carnivore crowd. So we actually are building a crowd of just animal-based eaters. And to be in that crowd, you have to have a fasting insulin under 5 or a visceral fat level in the bottom 25. I can't sit next to you and say you can only eat carnivore. It's impossible for me to measure that. But we think the best proxy for that is a fasting insulin or a visceral fat via a DEXA scan.
Let me ask you the question. I know you said you set up Hill. Who is telling, where do you get the information of what this is appropriate exclusion, this is appropriate inclusion criteria? Is there somebody that's like saying, hey, these are things that make sense, or how do you determine that?
Yeah, it's a little bit of trial and error. We talked to a lot of doctors who said, here's what we think it should be. And we've actually lowered our weight limit over the last couple of years. It's gone, I think, from 280 to 270 to 260. And we're trying to get down to a point of saying, hey, we want generally healthy people. We want people who take care of themselves in our community.
So, why not Andy, let me interrupt you. Just why not a BMI? Because 260 on someone who's 6'8" is different than 260 on someone who's 5'4". So do you have a BMI thing or something like that where it's more height But then
we don't.
it seems like you're discriminating against taller people in some way. Granted, 260 is big. You're not Shaquille O'Neal, and I get it. There's a number, but it seems like there should be, like obviously it's hard to do DEXA scans and everybody gets cost prohibitive and stuff like that. I get that, but
yeah. No, totally. And we make exceptions to that 260. I think BMI even is not great because if you are shorter and stacked, if you are shorter and have significant muscle mass, it looks like your BMI is really high, but in fact, it's not. Right. And so we thought about BMI in the beginning. We're like, that just doesn't make any sense. And so if somebody's over 260 and is 6'6" and looks like you do, and those people we let into the community. So we make some exceptions for people who have significant, muscle mass. I think in the end, it's almost impossible to have something that's perfect. We were thinking about A1Cs for our carnivore crowd, but A1Cs can be all over the place, just depending upon a host of things. And so we just didn't think that was a fair one. Fasting insulin and DEXA scan visceral fat were the best proxies that we could come up with, knowing that some people are going to be let in that shouldn't, and some people are going to be excluded that shouldn't. And it's just one of those things where we're not letting perfect be the enemy of good.
Let me ask you, because Medicare is Medicare eligible is an exclusion criteria. What about like Medicaid or something like based on needs and poverty levels and stuff? Because I know that's another state run or federal run thing that maybe
we have several people on Medicaid who use this as a supplement. And in fact, we have about 20% of our members have regular health insurance because they're either getting it free through their employer or very inexpensively, and then joining CrowdHealth and using us as a supplement, if you will, to what their plan pays. So if you have Cigna and Cigna says we're only covering up to $5,000 of your $10,000 bill, you can submit the remaining $5,000 to CrowdHealth. And we have a bunch of people who use it that way. But 80% of our people are totally reliant upon CrowdHealth. And in fact, they are uninsured. And I might be one of the few people out there saying we need more uninsured people as opposed to less uninsured people, because it brings back more market forces to just the hospital systems or the healthcare system.
What about children? And are you guys doing? Because I know there's some a lot of health insurance companies. One of their things is they provide routine preventative care. So you get your annual screen, you get your pap smears, you get your blah blah blah. Is that stuff you guys do?
Yeah, absolutely. So you get one wellness visit per year, and you can use it for gynecological primary care. You can use it for dental or vision. So there's a number of different things that you can use. And so we fully fund up to one wellness visit per year. So you can go to the wellness visit, you pay for that, and then you can submit that to the community to get funded. And you can do that once per year. Then in addition to that, if you have a mammogram or colonoscopy or things like that, you pay the first $500 of that. And then anything above that, you can submit to the community for funding. Here's a perfect example of something that's just crazy with the hospital systems and the insurance companies is a colonoscopy with a health insurance company will cost you somewhere between $3,000 and $4,500. With CrowdHealth, we're getting cash pay for colonoscopy of around $1,000. Colonoscopy. It's a pretty routine thing, and that's about a third of the price is what health insurance plans pay, again, just because we're going in and paying in cash. And so you can do a lot more of those preventative maintenance things if you're paying a third of the price. I think the system has said preventative actually is a money loser for the system generally, but it's a money loser because they're paying ridiculous prices. Somebody the other day just got a mammogram. I think it was for like $175. With a health insurance plan, you're paying $600 to $1,000. So we can find you much better prices for those types of services.
Yeah. And then would it be fair to say that a lot of people would use this as like catastrophic insurance or generally healthy? They don't go to the doctor much. And then if, God forbid, car wreck, whatever, or something happens, then is that the more ideal situation? A lot of people are like, hey, I don't go to the doctor. I don't like going to the doctor. I'm not sick, but I don't want to be in a situation where I have a car wreck and I don't have insurance. Is that or a way to pay, I guess, not
totally.
It's not insurance.
Totally. Yeah. I mean, I would say that most people are using this as, I don't go to the doctor very often. I talk or I listen to people like Dr. Baker and folks like that to really guide my lifestyle. And if I break an arm or have something significant, then I'll go and see a doctor. But most of our folks are doctor light and are pretty self-sufficient or self-sovereign over their own health. Our number one category of people who join us are entrepreneurs. So they're entrepreneurs, solopreneurs, gig workers, those types of folks. That's our number one. Our number two is actually medical professionals. So it's doctors and nurses. I think they work within the system and see how broken it is. And so they're our number two category of people who join us.
So under 65, sort of maybe not employed by somebody, maybe they're self-employed and generally healthy is probably the main core. Does it skew men or women? Are you guys, I'm sure you know your demographics.
It's 60% men, 40% women. So it skews a little bit on the male side. I think that's one, because we've really reached out to the carnivore crowd, tends to be a little bit more male dominant than it is female dominant. I think we were at that tomahawk eating contest. I think there was one female and 7 or 8 guys out there. And that made
an unfair advantage.
It is an unfair advantage.
Unless you're Molly.
It skews a little bit. And the other groups that we're really reaching out to are the folks that are kind of the other contrarians, that they see the brokenness of the food system. They see the brokenness of the financial system. They see the brokenness of the healthcare system. And so we have a lot of Bitcoiners. About a third of our group are Bitcoiners, and that tends to trend, more male based. So it's about 60-40, and it's 60% single, 40% family too. So we have a little bit more on the single side than we do on the family side, but that is changing as we grow. I think that this is so different than health insurance. It takes a little bit more trust to get your family on something like this than it does if I'm a guy in my mid to late 20s. There's not a lot to lose, but if I have a family that I have to protect and care for, there's a lot more to lose. And so we've built up trust with those families. And now I think we actually are skewing more on the family side than we are on the single side. Whereas earlier in our kind of life cycle of the company, we were much more focused on the singles. So that has now inverted over the last probably six months.
One of the things that you and I had talked about while we were at the conference or something like that is that we have, obviously our company, Revero, our goal is to get people metabolically healthy, maybe off a lot of these medications. And some of them may not initially qualify for a company like you due to the exclusion criteria being too sick. But once they get healthy enough, then that becomes an option for them potentially. So that may be a nice sort of symbiotic type of thing. And then, like I said, I'll have to see as we expand and get our stuff spun up, or where you guys could have a role with us potentially at some point as we start accepting payment.
For sure. I think we want to change the system. I don't know if we change the system only with really healthy people. I think we need to change the system with some of the sick people too. And so if there's a way to have people who have type 2 diabetes or something, another metabolic issue, and we say, hey, you can join us, but you have to go to Revero first. You have to be a part of that process. You have to get back to be metabolically healthy. You're going to pay a little bit more for CrowdHealth as a result of that, but we're going to get you back to where you need to be so you can be a part of the crowd and pay. Our crowd members paid $110 a person last month. There is a financial incentive here to get metabolically healthy. And I think some people need that financial incentive. For some reason, for people, and you understand this better than me, just having your body be healthy is not enough of an incentive for people. I don't get that. But if there's a financial component that's, hey, you don't have to go pay $1,200 for your family anymore. You can pay $500 or $600 with CrowdHealth. We can get you metabolically healthy. I think there is a really interesting incentive system there that we've already seen play out in many cases. We've had a lot of people come to us and say, hey, I'm 280, I'm 290, I'm 300. I know I need to lose 40 or 50 pounds to get back to where I need to be a part of CrowdHealth. And we've seen evidence of that people are incentivized to get that weight down so they can be a part of the community. And that's the way that I think our system should work. Right now, you're incentivized to do whatever because somebody else is paying for your healthcare costs. And that needs to change for our healthcare system to get healthy.
Yeah, you don't want to pick on people that are suffering from chronic disease, but at the same time, if it is something that you can literally fix through your own action, then you should be incentivized to do that. And I think that makes sense in a lot of ways.
Some people get the short end of the stick. Let's this as a doctor. Some people just get the short end of the stick, and it's just, there's nothing you could have done. And my dad had a stroke when he was in his late 70s because of a bad medication prescription from his doctor that led to significant bleeding. And that's just a bad end of the stick. That's just like you get it rough, and there needs to be some benevolence around that. But I think the studies that I've seen is about 80% of chronic conditions are lifestyle related. So those are things that you can change, especially if you're in your 30s or 40s or 50s, so that when you're in your 70s, 80s, and 90s, you don't have these chronic conditions. And what you're doing, I think, paired with what we're doing you're getting people healthier, so utilization goes down. we're working on prices to get prices down. If you can get price down plus utilization down, I think that's the path to fix our system.
Yeah, we have a bloated, inefficient, way too expensive system. There's no doubt about it. You look at our healthcare expenditures versus quality metrics, whatever it is, life expectancy, disease prevalence. It's just awful. You can you can do better in some people point to Cuba. That's a good example. That's just, there's better ways to do healthcare for sure. Let's talk about Washington a little bit, because you said when you were in Washington, they did something like, you can't practice here, we're going to sue you, or something like that. Why was that? And how did that, what were they talking about, and how did that resolve?
Yeah, we've had a number of states reach out to us and say, hey, look, you're practicing insurance, in essence, is what they're saying. They said, we have a set of laws on our books that says you cannot sell insurance unlicensed in our state. And to be licensed, there are dozens of qualifications and requirements and things like that. And so we've had a number of states come to us and said, you are practicing health insurance. And every time we've gone back and we said, no, we're not practicing health insurance. We are just providing a platform for people to help each other with their healthcare expenses. And so as I lay out how it works, which is Shawn breaks his arm and it's $5,000, I go to 50 people and they voluntarily say yes or no to help out Shawn with his broken arm. And then if you say yes, then $100 goes to Shawn. If you say no, then CrowdHealth moves on to the next person. That's more of a crowdfunding platform than it is a health insurance platform. And so as we lay out how this actually works, they've come back and they said, yeah, you know what? This is not health insurance. This is something totally different than that. And our number one risk factor here, our number one kind of barrier to growing is a regulatory environment that doesn't like anything different than the status quo. And many times in the blue states, anything that's not going to get you to a single payer government run system, they just don't like. And so when we bring a market-based system in here, that they don't like that. My pushback to them is saying, hey, especially in the blue states, where they're about people taking care of other people, and that's really important to them. We are a perfect manifestation of that. We have a community of people who've raised their hand and said, I am willing to help other people in our community. And that's how it was back hundreds of years ago. In agrarian communities, if you have something happen to you, the community would gather around you and help you out. We're just doing that digitally now. And that's why we're building these sub-communities like the carnivore community. If you go to the hospital and you're a part of United Health, you don't really give a shit, what United Healthcare has to pay for you to be there. There's very little incentive for you to care. If you're in a part of a community of carnivores, now it's me and Josh and Shawn and all these people funding each other's healthcare expenses. Then it hurts other people in my community as opposed to this big, massive international corporation. And so we've seen people have behavior change as a result of that. We had a guy in Dallas who had colon cancer, and he's, look, man, like, I've got colon cancer. I want the best doctors, but can you please help me negotiate? Because I don't want to screw the crowd. And so there's really a different incentive system here that is much more human than having health insurance. So that's what I point out to them. And a lot of them, especially on the blue states, are like, oh, okay, I understand that. I understand what you're doing. And so far, we've not had any state say you cannot operate here. Knock on wood, we've been able to address all of their concerns.
Well, you mentioned somebody goes in for semi-elective routine care. You've got time to say, hey, let's find you a provider that's going to give us a decent price and so on and so forth. What about emergent care? I'm in a car wreck. I get taken to the nearest ER and they do whatever. I don't get a choice in that typically. How do you guys, do you get in on the back end and negotiate the price down after point of care service, or how does that work?
Yeah, exactly. So if you go to the ER, the number one thing you have to do in the ER, and if anybody doesn't take anything away other than this, it's a valuable podcast with you. It's they have you fill out all these sheets of paper. So anytime you go to the doctor, there's probably 10 sheets of paper that you have to sign. And most of the time you just don't pay attention. There's one called the financial responsibility form. And basically what that says is, I will pay any cost associated with the visit, regardless of what the price is. And so what I tell people is, instead of signing it, put won't sign in there in that signature line, or you mark out the spot where it says, I will pay any price, whatever, and mark that out and say, I will pay a reasonable price. And that then gives you the ability to negotiate with them later. So first of all, do that in the emergency room. 99 times out of 100, they won't even question you. Then you get the bills afterwards. You submit those to us. And then we actually have a team of attorneys who will take a look at those and then negotiate with the hospital on your behalf to get those prices down. That's something that is reasonable. Because every time you get something from the ER, it's going to be an unreasonable price. They want to anchor you in an unreasonable price and then negotiate off of that. We know what a fair price is for all of those services and all of those markets. And so we can negotiate for you on your behalf and get those down oftentimes 70, 80% from that initial bill. So you don't have to do that negotiation. We'll do it for you. We've got attorneys that can do it. And so it's super easy for you to do that. All we ask you is gather the bills, upload them to us so that we can take a look at them and negotiate on your behalf.
Yeah, if you can remember just to go in, because they hand you 20,000 sheets, or not 20,000, but there's a whole bunch of paperwork you get every time. And you may be in a very scared state. You may be confused, and depending on where you're at, or if you're even sick and feverish. And so it's something. So if you fail to do that, if you just sign the form number, you guys can still negotiate that, even though you didn't put mark out reasonable. So
yeah, it just helps if you don't sign that paper. It is not like sorry, you're SOL, we can't negotiate for you. It just all gives us some leverage to negotiate with them, because in essence, it turns down to a legal case. We have a better legal case if you don't sign that page. Okay, got it. Impossible if you're in there for a stroke or something like that where you have no idea. And in that case, if they force you to sign them, then there's a legal case to say you assigned them under duress. And so there's also a legal case there too. And to be clear, they cannot refuse you care because you did not sign this form. That's part of I can't remember what it's called, the law, EMTAL or something like that. I can't remember the law that says you can't refuse somebody. Yeah, EMTAL. Yeah, they can't refuse you emergency care. If it's true, I guess they can say it's not an emergency. Hey, your cold is not emergency care. Go somewhere else. Go to urgent care or something like that. And in that case, you probably shouldn't be there anyway. And I've actually, because this is one of the concerns for people. They're like, okay, are they going to treat me differently because I'm uninsured in the hospital? I have asked probably 20 ER docs, and all of them, without exception, have said, we have no idea if the person in there has insurance or doesn't. We don't have a clue. And in fact, the hospital tries to keep us from it so that we don't accidentally break these federal laws, which have significant fines, penalties associated with them. So they don't know if you're insured. He's like, the only time I know if somebody's insured is we've seen them 4 times this week and they're drunk or high or something. Like, we can make an assumption they're not insured, but other than that, we have no idea what their insurance status is. So people shouldn't worry about being treated differently if they have insurance versus don't have insurance. Let me ask you about that, because let's say I get into CrowdHealth and then all of a sudden I'm start becoming drunk ER every 2 weeks doing something stupid. Would that be, do you have a sort of a contract that says, hey, look, if you start engaging in frequent stupid behavior, then you're no longer eligible? Is that something that could happen? There is something in our member guide that says if you consistently act like an idiot, then we can say probably goodbye. Probably not that exact language, but I'm sure something. I think actually idiot is in our member guide. It is officially in there. Don't act like an idiot. And if you do, we can ask you to leave. However, we cannot ask you to leave for any recurring illnesses. So we can't ask you to leave if, again, just have a bad luck and have 4 or 5 things happen in a year. We have not, will not, cannot ask you to leave if you have significant medical issues. Because it just doesn't feel right to me morally. If somebody has some bad stuff going on, you just ask to leave. That just doesn't seem to be a good member of the community if we were to do that. Yeah, and obviously it behooves you to keep your members healthy because it keeps costs down. So is there any sort of patient education, like this is what we think is making you healthy, going on a vegan diet? And obviously I'm kidding on that one, but do you guys get into that much? Yeah, I think it's more trying to get people to understand how their body works. And so we'll offer a lot of things on a month-to-month basis that will show people some additional things that health insurance wouldn't. So for example, I think it was 4 months ago, we had a DEXA scan that was, fully fundable. And so anybody who wanted to could go get a DEXA scan. We did a ton of education around what DEXA scans are and how they work and what they will show you. And we had a whole visceral fat conversation around that. We had a VO2 max 1, 2. So everybody who wanted to get a VO2 max, they could go get VO2 maxes. And we did a bunch of education around that. So we do about 5 or 6 of those every year. And these are all very low cost types of services. Health insurance plans won't pay for them. we will submit them to funding for our members because we think the educational component of that actually leads people to better health. And we do some things like that. We do some things on LP little a and things like that on the blood test side too, just so people can understand, how the blood test works and things that they should be looking out for and things like that. So it's less go and read something and more go and do something. Go do something that's low cost so that you can start understanding what's important and some of the biomarkers that you should be looking at.
Yeah, so your focus is more metabolic health than maybe the traditional
absolutely
cholesterol health or something like that, where a lot of people are focused on that. And so let me talk again about barriers to entry into this program. So if you're over 65 Medicare eligible, too bad, you're too damn old. Sorry. If you're over 260 right now, with few exceptions, if you're very lean or something like that at that weight for some reason, most people aren't, and you'd mentioned visceral. So, how does a person get in there? Let's say, like,
smoking.
Hey, Andy,
smoking is the other one.
And yeah, smoking. So I'm not a smoker. I'm not over 260. I'm good to go. Or what else do I got to do? What other things do I have to prove to say, hey, I'm reasonable?
That's really program? It. That's really it. And the great thing is, if you want to sign up, for an individual, it'll take you 5 minutes to sign up, and you can sign up immediately. So if you wanted to start, it's beginning of August here. If you wanted to start it today, you could start literally today, and it'll take you 5 minutes to get there. Or you can start anytime in the next 6 months if you want to. So you can sign up today and say, hey, I want to start December 1st or January 1st or whatever. So super easy, probably 10 minutes for your family. But there are no other limitations. We don't ask you to provide us with anything else. It's a very easy process to get on board. And then it's month to month. If you want to ditch us after a couple months because you don't like it, that's fine. But we don't have these open enrollment periods. It's not like you have to redo this every year. Once you're in. And the other thing too is I wanted to mention is there is a code Baker, BAKER. If it's $99 for the first 3 months. So if you wanted to join us and check it out and see what is this, you can make a $300 investment that will probably save you, if you're an individual, $300 or $400 a month, and try us out and see how it works. If you like it, awesome. If not, that's fine too. It's not for everybody, but yeah, you just use that promo code Baker when you get signed up. It's $99 per person for the first 3 months.
What about if you already have insurance? Let's say you're employed, you got healthcare, Aetna or something like that, and you're like, I want for some reason, I want the security of that, but what would the role of your company be in it? Because you're already paying this for $1,200, $1,500 a month premium, whatever. It might be $800 a month if you're single. How would that be of net benefit financially and otherwise for those people?
Yeah, it's a great question. The way I've seen it play out financially is the ones who have very large deductibles. Those are the ones where it makes the most sense. So I looked at my family. If I were to be in an Obamacare healthcare.gov plan this year, I think it was $1,400 and a $14,000 deductible or $16,000 deductible, something like that. And so if you have a $16,000 deductible, then you can submit anything of that deductible to the crowd and CrowdHealth. So it basically can help you with that deductible. It can also help you with things that aren't currently covered by your health plan. So we've got a lot of people who are into functional medicine, into more Eastern medicine, chiropractic, acupuncture, things like that health plans won't typically help you out with. And so they use their health plan for kind of your Western medicine type stuff, and then CrowdHealth for your non-Western medicines type stuff that health plans don't typically pay for. So that's the other thing that I've seen. So the services that are fundable by CrowdHealth are much more expansive than by health insurance plans, because we do have a lot of people who are into functional, integrative, naturopathic, holistic type of medicine. The beauty of that is those people tend to be healthier. They tend to not have the massive health expenses. And so while their functional or naturopathic or acupuncture or whatever might be more expensive, as a whole, they are less expensive because these are people who tend to take very good care of their bodies. So that's the other thing, that kind of scenario that I've seen play out. So like I said, 20% of people have their health insurance. Most of those actually are just like trying CrowdHealth just to make sure that they know what they're getting into. And then it was a dip your toe in the water kind of thing. And after a while, when they're up for the next open enrollment, they ditch their health insurance altogether and go with CrowdHealth. So there's a couple different scenarios there that we've seen.
So you have a base rate. You pay, I guess if you use that Baker code, $99 a month for 3 months, and then it goes to some other price, I assume, or a normal price. And then in addition to that, occasionally you may say, hey, can you kick in another $50 or $20 because One of our members just was in a horrible car crash and broke his leg and needs the surgery. How does that work out over the year? Like, what would be like the average member, like base rate plus the additional add-ons? And you said some people say, no, I'm not giving. You may have some people in there that are very just frugal and stingy. I'm not going to help out. And others that are saying, hey, I'm going to help out when I can. How does that work for the average person?
Yeah, everybody gets charged $50 a month per person, and that comes to CrowdHealth. We pay our corporate expenses that way. So if you have a family of 4, it's $200 that you're paying directly to me. And then we will ask you to help another member in the community up to $135 if you're single, or $405 if you have a family of 4 or more. So there's going to be a second request during that month. Say, hey, Dr. Bay broke his arm. Will you give $135 to him to help him with his broken arm? And so that's that second request. So for a single person, it's $50 to CrowdHealth. It's $135 to somebody in the community. For a family of 4, it's $200 to CrowdHealth. It's $405 to somebody in the community. Say between $200 and $600-ish. Now, those are maxes. So we only ask up to what we need in that month. And so in July, of that $135 for an individual, we only asked for 60 of it. So we only asked of the $405 for a family, we only asked for 180 of it. And so because the bills were so low over the summer that we just didn't ask for it all. And so it kind of averages out to $50 to CrowdHealth, $100 to the community. That's what the average has been. So $150 all in for an individual. And sorry, I guess
month.
that. Yeah.
Yeah, that's per month on average. So you pay $150. So that's $1,800 a year for total coverage.
And so that would be $500 for a family of 4 on average. But that's been the average for the last year. Do you know what the average for 3? I'm sorry. Just real quick. We've been in the market for about 3 years, a little under 3 years, and only twice have we asked for the full amount. And that's because we had 5 NICU babies at the same time, and that we were trying to get some of those bills funded. So we've only asked for that max price twice over our existing life.
And what is that, just for perspective? Let's say on average, you're paying $150 a month for healthcare for an individual. What is the average American right now paying? Do you know those numbers?
About $500.
500, so more than double. So basically, you cut your care in half, basically.
A family, for me, my family was going to pay $1,400. I've averaged about $500 a month for my family on CrowdHealth, so I'm saving almost $1,000 a month. So let's just call it $10,000 to $12,000 a year. The other thing too is I went to the hospital an ER visit once this year, and that was $15,000. I would have to pay almost all of that if I was in a healthcare.gov plan. With CrowdHealth, I paid the first $500 of it. The community picked up the rest, and so there's another, let's just say $10,000 that I saved. So my family and I have saved probably $20,000 over the last 12 months by doing CrowdHealth. The average family saves around $10,000. And so there's significant savings here by going with CrowdHealth versus the alternatives.
Yeah. And what else was I going to ask you on this? There is, oh gosh, I'm trying to think of another. There was something I wanted to share. We only got a few minutes left too.
No, that's great. One quick thing about this is we don't have deductibles. So what we do is we ask you to pay $500 to that health event, and then the remaining balance can be submitted to the community. And we did that because we figured everybody could come up with $500. You can figure out how to come up with $500. Because when I first started the company, what I found out was about 200 to 250,000 families every year were going bankrupt due to health expense, even though they had health insurance. And that was primarily because of these big deductibles. If you have a $14,000 deductible, but you don't have $14,000 in your bank account, you don't really have insurance. It's going to put you into real financial hardship. And so what we were saying is, look, everybody can come up with $500. So if you get pregnant, if you go to the ER, if you have cancer, it's $500. Actually, pregnancies is a little bit more than that, but pregnancies are $3,000 because it's something you can control oftentimes, but everything else is $500. So you should be able to come up with $500. And we just don't want to put people in bankruptcy. We don't think healthcare should put people in bankruptcy, and $500 is something reasonable to ask for people to have some skin in the game before we'll submit the rest of the community for funding.
Yeah, I remember what I wanted to ask you. So current size of your membership is, I don't know, several thousand, I think, if I'm not mistaken. What happens, hopefully, you get those numbers up to hundreds of thousands of people, scale. Will the cost come down with that, or will it stay the same, or what are you projecting? Because obviously there's economies of scale that sometimes can play into this. What are your thoughts?
Yeah, we're approaching 9,000 people that have signed up so far. And so we got a good group of people that we feel very good about taking care of big cancer cases. I think we've had 12 cancer cases, car accidents, brain hemorrhages, all kinds of big stuff. So non-Hodgkin's lymphoma, just crazy. And yeah, as you get bigger, there are more people to ask, in essence, for those bigger events. And so we do expect that the price will come down over time as you grow. We do think that the price will come down also with the carnivore crowd. So the carnivore crowd will be funding each other's health expenses. And if you don't have those chronic diseases that pop up with the general population, that crowd won't be forced to fund those. And so we think that the carnivore crowd, we also have a Bitcoin crowd that we're seeing that those prices are lower than the general community because they're just healthier people. So if you join us and become part of the carnivore crowd, use that code Baker, you're automatically in that community, you're eligible for that community. We think that you will reap the rewards of having a lifestyle that's healthier than the general public. So we believe that those prices will be lower over time than the general crowd.
Very good. That's awesome. Yeah, good to hear. Oh, let me ask you another question. If somebody gets injured, whatever, has cancer, are you like disclosing that person's name, or is it anonymous? I say we've had a member that 25-year-old male that maybe you, how do you like approach the ask to say, this is something I really feel strongly about, I want to give to, or somebody said, yeah, your kid had a runny nose, I'm not going to fund, well, you wouldn't fund that anyway, but I guess there's people that might want to make a choice on who they support.
Yeah, we keep it private. We only ask you once a month to help out somebody, and it says, we have a male in Washington that broke his arm and needs help with his $5,000 bill. Would you be willing to contribute $100 to this person? And you can automate it to automatically say yes. So you don't really have to even deal with it if you don't want to. So it's a very simple, easy process. It probably takes 10 seconds every month, an additional to what you're currently doing. But we think that 10 seconds is worth the, $500 to $1,000 a month that you're saving.
And the automation would only be up to the maximum cap, which would be $185 a month.
Exactly.
If you said this automatically sign me up for yes on everything, I'd still only be capped at $185 a month.
You got it.
That's important to know.
Yep.
Yeah. This is awesome stuff, Andy. I wish you well. And like I said, obviously you and I will continue to dialogue, and because we're basically aligned in many ways on how we can fix this god awful healthcare system we have in the U.S. and hopefully.
Well, thanks for everything you're doing. And I hope we can figure out a way to work with Revero and what you guys are doing over there.
Yeah, like I said, once we figure out our scaling and what we can, once we start approaching payers, obviously this makes sense to me just intuitively, and I suspect our Revero patients will be another healthy population that will be keeping costs down. That is part of the mission. That's the only way we're going to be successful if we can keep costs down. So. All right, man. Thanks. Tell everybody where we go to find us. How do they sign up? Give us another quick description.
JoinCrowdHealth.com/carnivore is where you need to start. Join CrowdHealth on all the kind of Twitter, social media, all that kind of stuff. Or Carnivore Crowd, also on Twitter and social media. We've had such an incredible response to this that our Carnivore Crowd Twitter or X account is actually larger than our corporate account. So we've had an incredible response to the Carnivore Crowd. So go check us out over on X or Instagram or joincrowdhealth.com/carnivore.
All right. So if you're carnivore and you're looking for an alternative to healthcare that, that's a good clue. And if you're not quite eligible yet, come to Revero and we'll get you eligible, hopefully. So anyway, awesome, man. Thanks for doing this, Andy. Appreciate it.